If you're turning 65 and trying to make sense of Medicare, here's the one thing I wish someone had told me at the start. Don't start by shopping for plans. Before you start comparing premiums or dental benefits or one of those Medicare Advantage plans advertising a zero premium, there's a bigger decision underneath all of it. You're really choosing between two different ways of getting your Medicare coverage. And one choice can affect which doctors you can see, how prescriptions get covered, what you pay when you actually need care, and even some of the options later on.
Medicare Advantage, or Original Medicare plus Optional Medigap plus Part D. Once I finally understood that, all those Medicare letters started making a lot more sense. So let me show you the map I wish I had from the beginning.
Hi, I'm Pauline, and I'm turning 65 myself, so I'm actually going through this decision right now. I'm not selling Medicare plans, and I'm not an expert. I'm the person who had to sit down, research all of it, and figure out what the heck A, B, C, D, and Medigap mean. I had to do this with the decision I was supposed to make. So, if you're staring at the same pile of information, hopefully I can save you some of the confusion. And we're going to do this together in three parts. Part one, this video. We'll start with the Medicare basic. What are all those pieces are and how they fit together. Part two, which is the next video, we'll look at your actual choices. Medicare Advantage versus Original Medicare with Medigap, including the costs, trade-offs, doctors, prescriptions, and what you really need to compare. Part 3, the third video. We'll put it together and walk through how to actually choose, checking your prescriptions and doctors, using the Medicare Plan Finder, understanding some of the expenses, mistakes to avoid, and the enrollment decision you don't want to miss. So today, don't worry about choosing a plan yet. First, let's make sure the Medicare map actually makes sense.
Before we get to those two roads, both of them start with the same foundation, Medicare Part A and B. Part A is mainly your hospital insurance. Think A as equal to admitted, inpatient hospital stays, skilled nursing care under certain conditions, hospice, and some home health care. Most people don't pay a monthly premium for Part A because they or their spouse paid Medicare taxes long enough while working. Part B is your medical insurance, doctor's visits, outpatient care, preventive services, and other medically necessary care. My unofficial memory trick, B is equal to basic medical care. Part B does come with the monthly premium. For 2026, the standard rate is $202.90 a month, though some people may pay more depending on income. Put Part A and B together, and you got Original Medicare. But here's the important part. Having A and B doesn't finish your Medicare decision. It just gets you to the fork in the road. This is the part that changed how I understood Medicare. Once you got A and B, there are basically two ways to get your Medicare coverage. Road 1, Medicare Advantage, also called Part C. Road 2, stay with the original Medicare, and you may add Medigap and a separate Part D prescription plan. These aren't just two insurance companies selling slightly different versions of the same thing. They're two completely different ways of organizing your Medicare coverage. And that's why I don't think the first question should be, which plan has the cheapest premium? The better first question is, which row fits the way I want to get my health care? Now let's look at what that actually means. Medicare Advantage / Part C. You still technically have Part A and B, but instead of getting your care straight through Original Medicare, a private company approved by Medicare handles your benefits instead. Most Advantage plans also bundle in prescription drug coverage. And depending on the plan, you'll often see extra advertised too: dental, vision, hearing. This is where my combo meal comes in. Instead of ordering everything separately, you get a package: burger, fries, and drink. That's my little trick for remembering Medicare Advantage. Part C equals the combo meal. And I get why that sounds appealing. One plan handling most of your coverage, some of them advertising premiums as low as $0. But here's where we have to stop looking only at the price on the menu. A $0 plan premium doesn't mean your health care costs you zero. You can still have co-pays or co-insurance when you actually get care. Plans can come up with providers networks, rules about how you access certain services, a drug formulary, and yearly out-of-pocket limit. So when we eventually compare Medicare Advantage plans, we're not just going to ask, what's the premium? We're going to ask, are my doctors in the network? Are my medication covered? What will I actually pay when I use healthcare? What's my maximum out-of-pocket exposure? And what rules or restriction matters for the care I use? That's part two of this series. Because the cheapest looking plan isn't necessarily the cheapest plan for you. Road 2, Original Medicare and Medigap. Now let's go back to the fork. The other choice is to stay with the Original Medicare, Part A and B. Original Medicare gives you broad access to the doctors and hospital that accepts Medicare, but it also leaves you responsible for deductibles and co-insurance and on its own. Original Medicare doesn't come with the same kind of yearly out-of-pocket cap that Advantage plans are required to have. That's one reason people may consider Medigap, also called Medicare Supplement Insurance. Medigap doesn't replace Original Medicare. It works with it. It can help pay some of the deductibles, co-payments, and co-insurance that Original Medicare leaves behind. Hence the name Medigap. It helps fill some of the gaps, and here's where this decision becomes more important than I initially realized.
If you're approaching 65, don't assume you can simply choose Medicare Advantage now and buy any Medigap policy you want years later if you change your mind. There are some situations where you have special protection guaranteed, issues rights, and the rules can vary by state. But the one that really matters is your Medigap open enrollment period. It's 6 months long, and it starts from the first month you're 65 or older and enrolled in Part B. During that window, insurers generally cannot use medical underwriting to deny you a Medigap policy or charge you more because of the health problems. After that period, depending on your situation and where you live, getting a Medigap policy later may be more difficult or more expensive. This is the kind of things I wish someone had explained to me before telling me to start comparing plan premiums. Because now we're not just asking, what looks cheapest this year? We're asking, what kind of coverage do I want? And what could this choice mean for me later? We're going much deeper into this road in Part 3.
There is still one Medicare letter left, Part D. Thankfully, this one's easy to remember. D equals drugs. Part D is a Medicare prescription drug coverage. If you go with Original Medicare, you'll buy a separate Part D plan. If you go with Advantage, most plans include drug coverage built in, though not every plan handles it exactly the same way. And here's another reason not to choose based on premium alone. Your medication matters. Two plans can look nearly identical until you find out one of your prescriptions is covered differently or isn't in the formulary at all. There's also a potential late enrollment penalty if you go without Medicare drug coverage or other credible prescription coverage for too long after you're eligible. So even if you don't take any prescription medication today, don't automatically write off Part D. The two roads. Okay, now forget the alphabet for a second and look at the Medicare this way. The foundation. Part A equal hospital. Part B is medical together. Original Medicare then comes through your decision. Row 1, Medicare Advantage. Part C, private Medicare, approved plan. You receive your A and B benefit through the plan, often includes Part D, may include additional benefits, can involve providers network plans, specific cost sharing, and coverage rules. My memory trick, the combo meal. Row 2, the original Medicare. Part A plus B, you may add Medigap to help cover some of the costs original Medicare leaves behind, and Part D for prescription drugs. Neither road is automatically the good one, and neither is automatically the cheap one. The best choice depends on how you use your healthcare and what matters to you the most. So, before you start comparing plans, I want you to think about 5 things. 1, your doctors. Are there doctors or specialists you want to keep? 2, your prescriptions. What medication do you actually take, and how would each option cover them? Number 3, how often you use the healthcare. Someone who sees a doctor twice a year may look at costs very differently from someone who regularly sees specialists or get more expensive treatments. Number 4, predictability versus pay-as-you-go costs. Would you rather pay a bit more each month for costs that are more predictable? Or would you rather keep the premium low and pay more as you go up to the plan's limit? Number 5, flexibility. How much does having a broad choice of doctors matter to you compared to the convenience or extra benefits a Medicare Advantage plan might offer? Those questions are a lot more useful than starting with which plan has the lowest premium. And they're exactly what we're going to use in the next 2 videos. Today was about understanding the Medicare map and the decisions you're actually making. In part 2, we're going deeper into your actual choices, Medicare Advantage versus original Medicare with Medigap, including what each can really cost you, how doctors and prescription factors in, and the trade-offs that aren't always obvious from the premium. Then in part 3, we'll put together everything and walk through how to actually choose, checking your doctors and prescription, using the Medicare Plan Finder, looking at enrollment decisions, and some of the expensive mistakes you want to avoid. By the end, you should be able to look at these choices and understand what you're actually comparing, not just which one is cheaper, but which one makes sense for the way I live and use healthcare. And because I know there's still a lot to keep straight, I've put together some free Medicare resources you can download below. My Two Roads worksheet to help you think through your own decision, plus the official 2026 Medicare cost guide from Medicare. Keep them next to you while you're researching, so you don't have to remember what every letter means, what everything costs, or where everything fits. Because I definitely wasn't going to memorize all this either.
If you're approaching Medicare too, tell me something in the comments. What's the one part of this decision that's confusing you the most? Doctors, prescription, cost, Medicare Advantage, Medigap? I'm going through this decision myself, and what you're struggling with may help decide what we cover next. Subscribe if you want to follow the rest of the series. I'm Pauline, and this is Modern Life Made Easier. Take care, and let's make sense of this Medicare together.